2 years ago, I carried legislation to outlaw leg chains, belly chains, and behind-the-back handcuffs on pregnant women who are incarcerated. We know that these shackles harm women. They make women unsteady on their feet. They make it extremely difficult to treat women in a medical emergency. And we also know that women in correctional facilities are more likely to experience miscarriage, preeclampsia, preterm birth, and low birth weight more than other women. Whether your priority is women, babies, public safety, or actually all of the above, these are outcomes that must be avoided. My bill, AB 2530, was adopted, as Jesse said, by the legislature without a single no vote. It was signed into law in 2012 by Governor Brown, and I believe this is because in addition to protecting women's health, this law also protects the safety of the public and law enforcement. The law also protects the safety of public and law enforcement by allowing alternative restraints when necessary. And it recognizes that only a woman's doctor can make the call regarding what is dangerous for her. Today, we've heard that 21 of 58 California counties have fully complied, and including our largest counties, as again, Jesse said, Los Angeles, and my home county of San Diego. I want to applaud their work to follow the law and to protect the health of pregnant women and their babies. Unfortunately, we have 32 counties that have only partially complied with the law. A number of these counties have already taken steps to complete their policies, and I want to recognize their responsiveness. The remaining 6 counties either did not respond or are not complying. I urge them to do so immediately. But overall, I think this represents a significant move forward towards sound public safety and health practices. As you heard, there were numerous times before 2012 to implement reasonable policies to protect the safety and health of women and their babies. And I really want to commend Assemblymember Lieber at the time, and certainly Nancy Skinner, who tried to pass this legislation before I did. I'm really proud that ultimately my legislation provided the catalyst for this progress, and I thank Legal Services for Prisoners with Children for initiating the study so that we can identify and recognize those who are succeeding and that we can encourage those who still have work to do. California has the 3rd highest number of incarcerated pregnant women in the nation, and most are serving sentences of less than 1 year, often for the first time, nonviolent, non-serious offenses. We want to give them and their babies the best possible chance for healthy pregnancies and productive futures. So today, we acknowledge an important step in that direction.